Hi, my name's Harriet and I'm a practitioner in the public health team at Devon County Council, and today I'm going to give an overview of the Healthy Start scheme and the Healthy Start Ambassador project that we are looking to expand across Devon. So Healthy Start is a national government and NHS-led scheme that provides eligible pregnant women and people and families with children under 4 with financial support. Specifically, this is to put towards fruit, vegetables, pulses, cow's milk, and infant formula. And the scheme also provides free vitamins for use in pregnancy and when breastfeeding, and also for children from birth. The scheme has income-based eligibility criteria, and you are eligible for the scheme if you receive certain benefits such as universal credit and are under certain income thresholds. The best way to keep up to date with the full criteria is to have a look on the Healthy Start website. In addition to the income criteria, you must either be at least 10 weeks pregnant and/or have a child under 4 years old. Anyone who's under 18 and pregnant is also eligible for the scheme, regardless of whether they receive benefits or not. In terms of the application, most people can now apply online on the Healthy Start website using a simple online form that takes a few minutes to complete. In rare circumstances, application via email or phone may be necessary, but this is not the norm. It is also worth acknowledging here that previously there was a lengthy paper application form that had to be signed by a health professional. However, this is no longer the case, and applicants will get an instant decision once they complete the form online. The amount that you receive from the scheme varies depending on your circumstances. In pregnancy, you'll receive £4.25 per week. For children under 1, it's £8.50 a week, and for children aged 1 to 4, it's £4.25 per week. These values are also due to increase in April 2026. The exact amount that you receive, however, is based on your specific circumstances. So, for example, if you have a 3-year-old and also a child under 1, you would receive £12.75 a week. The scheme is really important as it supports families who are experiencing the most financial disadvantage, and it aims to support the health and well-being of children by optimising nutrition in critical early periods of life. It does this by reducing the overall financial burden of food shopping, enabling increased purchasing and consumption of fruit, veg, pulses, and milk, reducing the cost of formula for formula-fed babies, and also ensuring recommended vitamin levels are met when intake can be challenging through diet alone. The scheme was made digital at the end of 2022, which has removed many of the previous barriers. This includes things such as the lengthy paper application form, the use of paper vouchers, and also limitations on the retailers who could accept the payments. Now, those on the scheme will be issued with a prepaid card, which works in the same way as a debit card. Funds are automatically added to the card every 4 weeks and remain on the card if unused for 16 weeks. The card can be used in any shop or with any retailer that sells the eligible items and who is able to take MasterCard payments. It is worth noting though that unfortunately the card can't be used online or over the phone. It does have to be used in person, either for contactless payment or by using the PIN. The card can be used to buy fruit, veg, pulses such as beans and lentils, milk and formula. The key takeaway is that these items must be plain with nothing added, but fruit and veg can be fresh, frozen or canned, pulses can be dried or canned, milk can be fresh, long life or UHT, whole, semi-skimmed or skimmed, and formula must be first infant formula. As the card can be used at any retailer that sells these items and can take MasterCard, in theory it is possible that the card could be used to buy non-permitted items. However, there is little evidence to support that this happens in practice. The scheme also offers vitamins for adults in pregnancy and whilst breastfeeding. The adult vitamins contain folic acid, vitamin C and vitamin D. Children's vitamins are also available and contain vitamins A, C and D. Breastfed babies can have vitamins from birth, and formula-fed babies can have the vitamins when they have less than 500 mils of formula a day, and this is because that formula is already fortified with vitamins. In terms of the uptake in Devon, as of November 2025, you can see on the map here that the uptake was quite variable in terms of numbers across each of the districts. Unfortunately, due to how the data is collected nationally, we don't know what proportion this is of all people who are eligible. But based on previous data and previous trends, we think this will be about 50 to 60%, depending on the district. Based on some insight that we've done relatively recently, we think the low uptake can partially be explained due to low public and professional awareness of the scheme, and also misunderstandings of the scheme based on previous knowledge and experience before it was made digital. As our uptake is quite low in Devon, we want to try and make sure as many people as possible are getting the support that they're entitled to. We think that by bringing the scheme into local communities and providing information, support, and where possible, the vitamins in places where families are already going or could easily access, this could have several benefits. This includes increasing the uptake of the scheme, potentially increasing the number of people and families using community assets or services, having an opportunity to link people and families with other local organisations, services and support that may be helpful or relevant to them, reducing the barriers to accessing vitamins where possible, and also providing information and access to support in trusted and non-clinical settings. The main functions of being a Healthy Start ambassador are primarily to raise awareness by sharing information about the scheme and also just being a friendly face who can answer questions, but also ensuring visibility of posters and marketing materials, including on social media as well. Additionally, another role where possible would be to provide help with sign up. This could be, for example, supporting people with digital access or skills or helping with literacy or form filling. But it could also involve signposting people to other informational services that they express interest in or that may be relevant to them. If you are interested in becoming an ambassador for your local community, we have some additional information available that can help support you with this. I hope this has been a helpful introduction to the scheme and what being a Healthy Start ambassador entails. Please get in touch with us if you would like some more information or support on this topic, or if you have any questions. I would also recommend taking a look on the Healthy Start website if you haven't before to find out more about the scheme in general.